CPR हेड एंड नीचे करें CPR बोर्ड लेकर आए गुड डन 6-year-old 15 kg male child was
Latent safety threats are often dormant within the healthcare system and can manifest at a given time, leading to devastating patient outcomes. They may include system deficiencies, equipment failures, training, or conditions predisposing to medical errors. It is incumbent upon us as a physician to educate our trainees and nurses regarding LSTs in order to improve system based practice. For instance, a seemingly innocuous error like the incorrect sizing of a bag mask for ventilation can escalate into a life threatening situation in a matter of seconds. Identifying and mitigating these threats preemptively is vital. Latent safety threats in healthcare constitute a significant yet often overlooked source of risk, particularly within high stakes environment of critical care. So this workshop basically had two intents. The first was the focus on latent safety threats to teach our participants and learners from acute care and high acuity areas like the pediatric ICU regarding identification, classification, and mitigation of the latent safety threats. And alongside this, there was also special focus on debriefing as a reflective practice to be able to look back at the events thoroughly and to see as to what could have been done better.
तो आपने बच्चे की जान बचाने के लिए 7 वाला डाल दिया। अब हम लीक को कंपनसेट करेंगे जब हम बेड से अटैच करेंगे।